Well, really, a big part of the answer to this question is also from the last one. You're not going to have additional resources to invest in anything like the medical school if you don't have the resources first. I am one of those people that doesn't believe that a cut to government is always a good in and of itself that outweighs whatever the adverse consequences are. I believe 7 years of cuts have demonstrated that it's just not a good idea to continue doing this. But unless we fix our structural deficit, where we have 5 more years of projected shortfalls of $1 billion a year. I know they said $775 million short for next year, but that's without factoring in the price of oil. It's really about $1 billion. We've got to do something about that. Now let me tell you, the medical school in Shreveport has been a tremendous asset for the state of Louisiana. I know of 3 people from Amite, Louisiana, my small hometown, who've been trained to be doctors there. And guess where they're working and practicing medicine now? In Amite, Louisiana. I absolutely believe in it. I know that the LSU system has done a great job with that hospital over the years, but that hospital is struggling now, and it's tied up in all of the problems associated with the LSU system and the hurried manner in which the privatization took place and the private partners were brought in. And I'm not here today to fix blame, but I am here to tell you as a governor we're going to fix the problem. My mother was an emergency room nurse in a charity hospital for 30 years. The only hospital that's still state-owned and state-operated, by the way. It happens to be in my district. But I'm committed to making sure that people have access to high-quality medical care through those hospitals. And the way that this was done in such a hurried fashion, we actually took federal dollars from the federal government that we weren't entitled to. We owe that money back. The governor has filed an appeal to make sure that we won't pay it back until after he's gone. So it won't be his problem, but it will be our problem. And it's going to be tens, if not hundreds of millions of dollars we're going to owe back. And secondly, we don't have a sustainable revenue stream in place to know how much that program is going to cost us. And any year we don't appropriate enough money for these private partners to stay in these hospitals, they get to give 60 days notice and walk away, because that's the contractual arrangement that they have. And so every year when we go into legislation, if we don't do something long term, then they get to tell us what they require in order to stay in the hospital. We either appropriate or we don't. And if we don't, we have the most vulnerable patient population that will not be served. And we were the last night of the session this year coming up with the money to fund our safety net hospital system. I know because I was in the room. There were 5 state reps and 5 state senators in there trying to find the money. And we're dealing, well, if we increase cigarette taxes this much, we'd get an extra few $1 million. We were the last night of the session trying to come up with the money. And so the hospital's success and the medical school's success are tied together. You cannot separate them. But I'm committed to fully funding the medical school and the hospital to make sure that they can work in concert and that they will be strong and continue to do the good for the state of Louisiana that they have. You all send a lot of folks to New Orleans to go to medical school, and for some reason in South Louisiana we send a lot of folks up to Shreveport, and it's worked very, very well. And I'm committed to making sure that it works, working with the model we have, but finding the solutions necessary to make sure it's sustainable over the long term with a dedicated revenue stream to support it.